Topic: Chapter 7, Professional Conduct and Scope of Practice. Module: Describe the role of the RBT in the service delivery system. A Registered Behavior Technician Review. A RBT is a paraprofessional who practices under the supervision of a BCBA or a BCABA. The RBT's primary responsibility is the direct implementation of treatment plans developed by the supervisor. The RBT may also collect data and conduct certain types of assessments. The RBT does not design intervention or assessment plans. It is the responsibility of the designated RBT supervisor to determine which tasks an RBT may perform as a function of his or her training, experience, and competence. Chain of Service Delivery Review. Whereas individuals with the BCBA or BCBAD credentials are generally responsible for service delivery oversight, individuals with the BCABA credential generally operate in a position assisting these supervisors, and individuals with the RBT credential will be responsible for implementing, not designing, the behavior plans designed by their supervisors. The RBT's role in service delivery is to prepare data collection, implement measurement and recording procedures, maintain data, assist with student assessment procedures. Examples of these would be curriculum-based, developmental, social skills, assisting with functional assessment procedures, observational recording of behavior and environment. To implement a variety of teaching procedures, for instance, discrete trial training, naturalistic teaching, stimulus control, stimulus fading, discrimination training, and use of contingency reinforcement. To understand essential components of a behavior plan and implement behavioral reduction interventions. For instance, differential reinforcement procedures and extinction procedures. To accurately document and report and effectively communicate with your supervisor. To manage students' behavior utilizing de-escalation and support hold training techniques. An RBT must have a willingness to learn new software and use of adaptive equipment as appropriate. Also, RBTs meet students' and environment needs as required. They assist in the creation of instructional materials, and they effectively respond to and manage crisis situations which may include physical aggression. Within the RBT's service delivery role is the overall ABA service delivery team. Most ABA treatment programs involve a tiered service delivery model in which the BCBA designs and supervises a treatment program delivered by BCABAs and RBTs. There are two different examples of how a service delivery team could look. A BCBA oversees a treatment team of RBTs, or a BCBA is supported by a BCABA, and the two of them jointly oversee a treatment team of RBTs. In both examples, 100% of RBT time is direct implementation of treatment plans and behavior intervention plans, along with data taking and graphing. The tiered service delivery model assumes the BCBA or BCBAD is responsible for all aspects of clinical direction, supervision, and case management, including activities of the BCABA and RBTs. The BCBA or BCBAD must be familiar with the client's needs and treatment plan and regularly observe the RBTs implementing the plan, regardless of whether or not there is clinical support provided by the BCABA. The rationale for the tiered service delivery model rely on the use of BCABAs and RBTs as the primary mechanism for achieving many of the significant improvements in cognitive, language, social, behavioral, and adaptive domains. The use of carefully trained and well-supervised BCABAs and RBTs is a common practice in ABA treatment. Their use produces more cost-effective levels of service for the duration of the treatment. It additionally permits sufficient expertise to be delivered to each client at the level needed to reach treatment goals. Finally, they can help with treatment delivery to families in rural and underserved areas.